COVID-19 cases and deaths reported in Africa are said to not to be a true representation of how the virus has affected the continent. Africa had previously been praised for its response to the pandemic, but experts say that the continent may not have necessarily fared better than other parts of the world. Groundup, in fact, has published a piece analyzing how COVID-19 data has shown, or rather should have been measured in order to get an accurate picture of the impact of the virus itself. One of the co-authors of that article is Nathan Geffen, who's also the editor at Groundup. He joins us now via our video link. For more on this, Nathan, it's great to see you. Thanks very much indeed for speaking to us. In the past, the impression, perhaps even the narrative, had been that Africa has been spared the worst of the COVID-19 pandemic. Is that accurate?
Hi, and so first of all, let me start with an apology, because it's a nice September morning here in Cape Town, and I'm about to talk about a topic that all of us are very, very tired of, which is COVID and death. And I feel a bit like the Grinch who's stealing spring. But I do want to say that I'm going to give some bad news, but actually there's some positive news and a positive message at the end of it, if people will bear with me. So imagine if we didn't measure the GDP and we released statements like the economy is doing well, or if we didn't measure the crime statistics and we said we're bringing down the number of murders. And that's pretty much what's happened with COVID through most of the African continent. Now, obviously, Africa is a big continent, and there are lots of countries. There's over 50 countries. So I don't want to generalize too broadly, but by and large, African countries have not measured their responses to COVID properly. And the little bit of evidence we do have suggests that the epidemic has been as bad here, if not worse, than in other parts of the world. Can I get to the good news, Ayanda? And that is that South Africa has done an excellent job of measuring how the epidemic has hit us. And that's because we have a good system in place that measures where people, when they're born, they're registered. When they die, they're registered on the Home Affairs system. Not perfectly, but by and large. And every week since the beginning of the epidemic, the Medical Research Council has been taking this data and releasing a report which compares the number of deaths that we've been experiencing week by week against the historical average before COVID. And through that, we know that we've actually been hit very, very hard in South Africa with COVID deaths. We've had about in the region of 300,000 COVID deaths, which is high. One of the highest per capita in the world. And yet, if you look at our neighboring countries like Lesotho and Zimbabwe and Botswana and Mozambique, their official stats are much, much lower, and that's just not plausible, as Professor Venter and myself have argued. But I think we can commend South Africa for having that system in place. But more than that, the positive message in this grim news that we want to convey is that it's not rocket science to build these systems. And there's no reason why the World Health Organization, together with institutions like the African Center for Disease Control, can't work with African governments across the continent to build those systems so that their systems are as good as the South African one. And that should be, instead of singing our praises as to how we've responded to COVID, that should be the aim going forward, to build the systems in place so that we can properly measure the health of the people of the continent.
Yeah. The conversation around excess deaths has been an important one since the beginning of COVID-19. But as you're explaining there, I was wondering to myself, the way in which we measure excess deaths, are we saying there could be nothing else causing these fatalities outside of COVID-19?
No, we're not. The Medical Research Council actually publishes reports has published a report explaining exactly that. No, we can't. But what they have done is they've analyzed the deaths and they've compared the deaths to the test data and what's happening with the epidemic, and they've done a very careful analysis and reached the conclusion that 85 to 95% of the excess deaths are due to COVID.
Fair enough. For those perhaps who are struggling to connect the dots, why is that an important figure for us? Because, in many instances, you'd want to prevent deaths from happening. But if the deaths have already happened, I mean, perhaps it's useful for academics and scientists who want to study trends, and maybe I'm answering my own question, but you explain to us why something like this would be an important statistical piece of data that we need to insist knowing about and understanding.
So one of the biggest jobs of government is to provide, is to care for the health of their population. And we spend hundreds of billions of rands every year on healthcare in this country. If we want to see if those interventions are of benefit, if they're helping people, then we absolutely need to look at mortality and how people are dying, not just the excess deaths, but various breakdowns of the way people are dying. And the data that comes from Home Affairs and that the Medical Research Council, together with UCT researchers, I must say, analyzes, helps us see whether the health interventions that we're implementing are working or not. So it's absolutely vital. It's just like if we want to measure the health of the economy, we need a whole bunch of statistics, and if we don't have them, we can't tell whether the various interventions that government does in the economy are working or not.
Yeah. You know, the other complication here, of course, is that the vaccination rate in Africa has been comparatively much lower than in other parts of the world. In what ways does that muddy the waters as we try to ascertain how devastating COVID-19 was in the face of the reality that other countries are just better equipped to be able to respond to the virus too, or continents?
Well, I mean that's a very big and complicated question, because there is a whole bunch of reasons why the vaccination rates across the continent are lower than the rest of the world. And there's a big debate to be had around why that happened and how we prevent something like that from happening again in the future. But it definitely suggests that African populations have not been as well protected against COVID as they could have been. Had both African governments got their act together to distribute vaccines, and governments around the world have done a better job of ensuring that Africa had vaccines.
Absolutely. Well, it's an important discussion that we need to keep alive. Thanks very much indeed for speaking to us. Nathan Geffen is the editor at Groundup. They actually published this piece where essentially they raise questions about whether or not it's accurate to say that Africa was spared the worst of the COVID-19 pandemic. In fact, on Newsfeed AM, in case you missed it, Kolim Gambi will have a discussion around how many children may have been orphaned by the pandemic as we continue counting the cost of this devastating moment in our history.